Afternoon, everybody. Good. Okay, so my name is Neftali. I am a navigator for the Beatrice W. Welters Breast Health Outreach and Navigation Program. Very long title. But I have here a client of mine, Claude Jean-Pierre. Do you want to speak here or you want me to give you a mic?
Yes.
It's fine. Hey, he's a gentleman that was enrolled to our program, and he just wants to say a couple of words about his experience with the program and how we were able to help him with some positive outcomes. Right? Let's go.
Yes. Yes, good afternoon. Yes, my name is Claude Jean-Pierre. So I'm here today because first of all, I start to have prostate cancer. And from prostate cancer, medication all the time. From medication, they are one of them. Every time I've got this medication, it's swelling my breast and it gave me pain. The first time, I rushed to a lab. They make a mammography for me, and they found out that there is nothing in it. And the second time, after 3 or 4 months, there is no pain, but still swelling. And after 3 injections, my breast is still swelling bigger and bigger, and it always gives me pain. After 3 or 4 months, it's gone. The last one, it stayed for nearly 1 year. In January, I go to the doctor, show him my breast. I say, I still have the pain. And he sent me to make another lab. So now they find out that I have a cancer in one of them. So immediately they send me here. And when I come here, I found Mr. Neftali, and he take care of me and everything. And the hospital is very great. And they take care of me. And immediately in May, they start a program with me, and in June, they make a mastectomy in my breast, and my left breast. And the other one, which was a very long breast also, they make it flat for me. Now I'm normal, even without one breast. And I hope that things like that will not happen. If I was neglected to go to the hospital, to have a mammography like every woman, right now, maybe I don't know what will happen, because I know this problem, when you have it, it's acting like a demon in your body. Because I have 3 people I know. One of them was a doctor, a woman. They die from breast cancer. So I hope everybody here, men or women, if you have a friend or anybody, tell them about that problem, because this problem is very dangerous. I know that because I have people who die from it. Thank you very much. Yes.
So that was fairly touching. I'm a little, choked up. So our program, the Welters program, was designed specifically to reach out to those communities in where we saw, I don't want to say neglect, but we saw that women especially weren't really going out and getting their screening done. So it was designed to be a navigation program for 3 tiers, right? So it's in our title, Beatrice Welters Breast Health Outreach, Navigation, and Education. So one of the first steps that we take is we conduct outreach, which is fairly straightforward. We are in the communities. We attend health seminars, or we attend health fairs. We do tabling. We provide literature, and sorry, can everybody hear me? Am I speaking loud enough? All right, great. And we go ahead and we just provide basic information about our program, how you can sign up, and it's totally optional if that's what you want to do. But we're there to help, to kind of be a middleman between the screening you haven't gotten and the screening you will get. The second thing we do is we conduct education, and education is done in a closed setting within a room just like this, and we go over cancer. What is it? How do we get it? How do we help reduce our risks? What are the risks? What kind of tests we can do? How we can prevent it, because the biggest thing about the program is really screening for prevention, right? The earlier you get it, the better it is. if something does come up, it's easier to treat the earlier we find out. The final thing, and frankly, for me personally, one of the most important things is the navigation. And it's not simply just saying, hey, you haven't gotten your screening, so let's go ahead and get your screening done. But we work you through that process because we understand how difficult it is for, to navigate the hospital system sometimes. I mean, even for me, I work over at Bellevue. That place is like a maze sometimes. And we kind of help usher you into what exactly it is that you need. And we do so by covering what's in the way, what's stopping you from getting these screenings. And like Lelia mentioned before, we have a lot of different things that get in the way, and we want to make sure that there is nothing in your way. So whether or not we can navigate you around that problem or completely remove that problem and navigate you through it, that's what we do. Insurance issues should not be a problem for you. Price issues should not be a problem for you. Transportation should never be a problem for you. So whatever it is that's keeping you from getting that done, it is up to, it is with our help, hopefully, that we're able to kind of get that out of the way so you can go ahead and complete your screening. On top of that, if for instance, in Claude's case, he was given a diagnosis. Our jobs don't stop at the screening stage. We continue to help you through the diagnosis, get you the appointments you need. If we're having difficulty with, collecting information, because we do need like any kind of prior images or any kind of prior exams, we want to make sure that our physicians and our staff have all the information to treat you in the best manner that we can treat you. So it's up to us, with your help, to go out there and get everything together, put everything you need so that we can provide you with the best care possible. In the event that, we continue on to treatment, again, we're there by your side. Anything to cover whatever issues, whatever anxieties you may have, we're able to kind of talk you through it, give you the support that you might need. Especially, Lelia talked about social isolation. Even people with robust families, I have a huge family, but to be honest, I'd probably not tell anyone if I was sick. And that's just something that, we deal with. And having a navigator there, may not be a family member, may not be a friend, but someone that you can talk to, you can kind of go over your options with, someone that is here working alongside with you, is beneficial. It helps. And it helps kind of pull some of that anxiety away from continuing with treatment, because a lot of people out there do their screening and they don't continue when something is found. They may not understand that, in terms of like densities, when we spoke about the radiological tests, dense breast is not an uncommon thing. It's very natural. And sometimes when you're called back for additional imaging after a mammogram, there's sometimes some fear or anxiety or trepidation that there's something wrong. We can kind of talk you through it, explain that everything's fine, or, kind of be there with you, even if it means going to your appointment, even if it means, helping you schedule every single part. That's what we're here for. That's what we're available to do for you. It's, for me personally, the whole process of navigation is all about kind of empowering you, right? It's about giving you the tools and the knowledge that you need in order to say, okay, this is what I have to do this year, or this is what I have to do in 6 months, or okay, what are my options? I'm a little worried, but we're going to continue because I know that there are steps to be taken and that my personal health and well-being should be paramount, right? A lot of people don't kind of take care of themselves because they have families, but in order to take care of your family, you have to make sure you're at your best shape. You have to make sure that your health and your wellness is taken care of so that you can make sure that your family is taken care of, or that their healths are taken care of. We have outside a lot of our literature, a lot of information. We do collect some information anonymously so that we can kind of target things a little better. If you'd like to sign up for the program, or if you know anybody that could use our help, and again, even if it's everything from a polite nudge, maybe a phone call to remind them of an upcoming appointment, or knocking on their door, making sure they go, and taking them personally to the appointment. That's things that we can help with. So I think that's pretty much sums up what the program is for. I believe Ms. Welters is up next. I will leave it up to her to continue, right?